Welcome to this video on a practical way of diagnosing opioid use disorders in a busy clinic in Sri Lanka. From the series on substance use disorders, treatment, and rehabilitation. So let's first look at a few case scenarios. Case scenario A. Person A, age 32, manual laborer, father of two, who uses heroin 2 to 4 times a day to the worth of up to 4,000 rupees for last probably at least 2 years. Altogether, he has used heroin and smoked cigarettes for over 6 years. He claims he develops the sick if he does not use heroin for more than 6 to 8 hours. His last use was this morning, about 10 hours back, and now he has visible goosebumps, dilated pupils, and repeated yawning, and is in pain and in distress. Yeah, there are severe marital problems, and he is not supporting his wife and children. Person B, age 32, manual laborer, father of two, uses heroin, same story, but once or twice a day to the worth of up to 2,000 rupees most days of the week. If he does not have money, he does not use for many days. But if he gets money, he uses daily as long as he has money. Altogether, he has used heroin and smoked cigarettes for about a year or two. He claims he develops the sick if he does not use heroin for more than a day. His last use was day before yesterday, and now he says he's in severe distress, but he does not look ill or in pain. There are some marital problems, and he's not supporting wife and children in a regular way. Person C, age 32, manual laborer, father of two, uses heroin. And in this person, he uses heroin whenever his cousin returns from Colombo with a supply, which is around once a month. As the cousin could not visit for over 2 months due to the COVID lockdown, he now has not used for over 2 months. He has used heroin like this for about 6 months, like a month or so, once a month or so, but had smoked cigarettes occasionally for over 10 years. He claims he feels he has a bit of the sick today and decided to seek treatment. He does not look ill or in pain. His wife is not aware of his heroin use, and there are no serious marital or other issues. Right. Now let's look at the few diagnoses that we are faced with every day in our busy clinics. Opioid withdrawal state. That is what happens when somebody uses opioids in a prolonged manner several times a day. And then he stops use for 6 or more hours, sometimes even shorter in some users, and then the person develops certain particular symptoms and signs, and that is opioid withdrawal state. So what are these particular symptoms and signs? This is from the Maudsley prescribing guidelines in psychiatry. So what we have here is diarrhea, nausea, vomiting, stomach cramps, agitation, anxiety and insomnia, muscular pains and headaches. In addition, we see rhinorrhea and maybe yawning and some other symptoms in our patients at our clinics. Now, let's look at the other diagnosis, opioid dependence. Now, this is the typical way of diagnosing, or the textbook way of diagnosing it. Look at the 6 ICD-10 criteria. You have to, the person has to fulfill 3 or more criteria. And to diagnose opioid harmful use, the person has to fulfill the 6th criterion, use despite harm, and then he may fulfill another criterion as well, or he might not. But let's not go down that textbook pathway. Let's look at this practical way of diagnosing opioid use disorders in a busy clinic. So opioid dependence, to be diagnosed, what we need to look at is the pattern of use of opioids. It must be daily use and more than once a day. If the pattern of use is daily and the person uses heroin more than once a day, the most likely diagnosis is opioid dependence. However, you would also verify uh, the withdrawal state the person complains of, if he is in withdrawal, by corroborating it with physical examination findings, such as you may see the patient is yawning, a patient is in pain and distress, there are goosebumps and dilated pupils and so on. Right, now opioid harmful use. Here, let's look at the pattern of use again for a quick diagnosis. It's a daily use, but only once a day. And there are usually drug-free days. If the person doesn't get money or whatever, there are drug-free days from time to time. Or it's just non-daily use, several days a week or so. Then, if that is the pattern, this is most likely opioid harmful use, or harmful use of opioids, or harmful use of heroin. Now, if we look at opioid use disorders, the less severe disorder is the harmful use of opioids, and the more severe disorder is dependence on opioids. So it is a spectrum from this end to that end, and people may fall in between. Right. Now let's look at our case scenarios and try to quickly diagnose them. Person A uses, let's look at the use pattern, which is the key here. Person A uses heroin 2 to 4 times a day, and for a considerable period of time. It doesn't have to be 2 years, even less. You can diagnose it. And so the pattern of use is highly suggestive of opioid dependence. And he also claims that he has withdrawal symptoms. And when you look at him, when you examine him, you find findings that verify, that support his claim of having withdrawal symptoms. So this is most likely to be opioid dependence. Let's look at the next patient, person B. That person also uses heroin mostly daily, uh, sometimes once and sometimes twice. Um, most days of the week, but not every day. And he can go on days without using heroin. So this pattern, once a day use, rarely, maybe sometimes he may use more than once a day, but mostly once a day, and not every day. Not every day. So this is most likely to be a harmful use of opioids. Although he claims he has withdrawal symptoms, when you examine him, you see nothing to corroborate his claim. So this could be his learned behavior, because we see many patients, irrespective of the fact that they have withdrawal symptoms or severe withdrawal symptoms or not, they all seem to claim that they have withdrawal symptoms. So you need to verify that with one pattern of use and then physical examination findings. Person C, he uses heroin very infrequently, like once a month or even less. So such a person is not going to have withdrawal symptoms. Obviously, we are not worried about that, although he again claims that he is having withdrawal symptoms, but he doesn't look as if he have any withdrawal symptoms. And his use is so occasional and short-lived, so you might hesitate to give him any diagnosis. If at all, you would give him the diagnosis of harmful use of heroin. Perhaps you might stop short of giving any diagnosis. Right, so that's how we use this quick way. And let's look at the summary of things that we learned today. So we know the main symptoms of opioid withdrawal state, and we know what it really is, and then what opioid dependence is, and the quick way by looking at the pattern of use, how to diagnose it, and then opioid harmful use. So hope you found this video useful, and hopefully you will watch other videos on this series on substance use disorders, treatment and rehabilitation, made for doctors working in busy clinics in Sri Lanka.